one of the common experiences, I think, for a lot of psychologists is around imposter syndrome or our confidence goes up and down. And I
Yeah,
think that's because largely, unlike a mechanic who is he's doing the work or she's doing the work and people are watching, we're in a room. No one sees what we
yeah,
do,
yeah,
really.
yeah,
So it's a real, I think, really prime to have some imposter syndrome or some confidence lower.
yes,
How, I guess, on your journey, you know how effective you are now, right? You know
right,
how many people get better, what percentage
right,
get better, how many drop out, or how are engaged in your treatments because you're using Fit. And
mm,
how has that, for better or worse, impacted your confidence or imposter syndrome if you have it?
right. I mean, who doesn't at times?
Yeah, yeah. I didn't want to
Who
assume.
doesn't? Yeah. Well, it's it's you know, how has it impacted my confidence? It's just like the data is there. It's showing, with the bell curve of average, I'm at on the kind of, the this end of the average. If we're looking at reversed, I'm average, and that's good,
Yeah.
And so it actually helps me to really remember if I have imposter syndrome, it's probably the part of me that is judging me as opposed to what is it that needs to happen for this client in this situation to get better. So,
Mm.
and if it isn't happening by, the first three, 3 to 6 sessions, you will see the ORS should be going up, should be on track. And if it's not, it's on me to keep going. What needs to be added? What needs to be subtracted? Who else do we need to add into the treatment? Maybe thinking about, medication. Who knows? Whatever it is that works for that person. So it really takes the load off me. Like I'm
Mm.
not the one who is in, you know, going to be the magic ingredient in this client's life. Everyone is in a very complex uh, environment,
Mm.
individual, personal, social environment. And so for this person at this time, so if they're not progressing, if they're not on track, just because of all the meta-analytic data, it just goes, we should be really looking at, I may not be the right person for them. And so the training
Mm.
has just helped me to go, I can't be right for everybody. I can't
Mm.
work with everybody. That's just basic.
Mm.
So, and I say that to people on my intake phone call. It has to be a good enough fit between the three of us. It's your
Mm.
feedback to me is really important about what you're needing. And, that's going to show us whether I am or I'm not the right person. So I'm talking to them from the first session, the intake phone call and in the first session that we're seeing whether our working alliance is going to be good enough to help you get to where you want to go. And
Mm.
I really want to hear your feedback, and if I'm not the right person for you, I can help you to find appropriate referrals and stuff. So it takes me out of the
Mm.
limelight so that it's in a way it relieves the imposter syndrome. It's like we can't be it for everybody.
Yeah.
So
Yeah.
I don't know if that answers the question, but yeah, every now and again I'm wobbly, particularly when I think with the SRS at the end that I thought the session's gone well and they've gone, no, no, I would have wanted this or that, the other. Well, thank you. It's
Yeah.
humbling.
Yeah.
So, and that's good.